Have you ever gotten H. pylori testing and your results didn't come back as high, but there was some H. pylori on the test? Should you treat that H. pylori or not if your results aren't high? Today's podcast episode comes from this very same question that Tracy B submitted via our Ask Allison program. She asked a question like this: I have the GI map test and H. pylori came up as a marker, but it wasn't high. Do I need to treat this? Is H. pylori a problem and should it be treated? If you're wondering the same thing, or you are looking into H. pylori testing and you're wanting to know this answer as you prepare to get testing, then this episode is for you. Also, want to ask a question just like this and get an answer from me? Go to betterbellytherapies.com/Ask Allison or click the link in the show notes and submit your question there. I may just answer it on the podcast just like this. Now, let's dive in. Hey friend, welcome to the Better Belly podcast. If you're currently trying endless supplements, doctor visits, and diet changes to heal your mystery symptoms, you are in the right place. We're here to solve the real root causes behind your gut, hormones, skin, sleep, and brain concerns. Literally anything and everything in your body. My name is Allison Jordan. I'm a functional medicine practitioner that has supported over 150 clients just like you to heal problems that no one has been able to fix. You don't need a perfect diet or a random supplement you found on Instagram to heal. You need a proven system that heals your whole body from the inside out. That's what I'm here to share with you, episode by episode. It's time to make health easy again. And just as a reminder, this information is not meant to diagnose, manage, or treat disease. Always consult with your own health practitioner before you make any changes to your health.
Hi, Allison. I have a question about H. pylori. I have had the GI map test, and H. pylori came up as a marker, but at 2.0 whatever. Just wondering if that is a low percentage or if any marking of H. pylori is an issue and it needs to be treated. Thanks.
All right, Tracy, I'm so excited to get to answer your question here today. And just as I mentioned in the intro, again, for anybody, if you have a question yourself that you would like me to answer, it can be about any topic. You can go and submit it to betterbellytherapies.com/Ask Allison, and I may answer it live here on the podcast with my own voice, specific to your case, your health history, anything you want to share, and give you resources, just like I am today on today's podcast. But to dive into Tracy's question, before we get further, I also want to mention, Tracy, I highly recommend you go and listen to our episode 233 called H. pylori, Symptoms of H. pylori, How to Interpret H. pylori Results, and why H. pylori treatments fail. This episode is very comprehensive, and I like to call it my master episode on H. pylori. And so it's going to give you a lot of highlights on things to do as you're choosing to treat it, and things to avoid, and red flags on the practitioner you're working with if they might be approaching it in a way that won't be helpful or won't work. But to answer your question, this is my approach to H. pylori on a GI map, and I'll explain why. If you have any H. pylori on the GI map at all, then I do recommend that you treat it. And for those of you who are not familiar with the GI map, it's a stool test, and when you get your results for the H. pylori, it is possible for it to come back with H. pylori where you have a number, but it is not greater than the standard lab range. So if the number is greater than the standard lab range, it's going to turn red, and that means it's high. And then if it's not greater, it'll be just gray, like basic. But here's the other thing. You can actually have below detectable levels of H. pylori, meaning no one needs H. pylori in their body. It's not like you can have a low level and it'll be bad. And so for the purposes of my clients and through the research I've done on H. pylori, I found that if somebody has H. pylori on the GI map, it is not helping them. And so if you're doing the GI map at all, it's because you have symptoms. You don't feel good. And what I found is that I've had plenty of clients come back with a GI map that the H. pylori levels are not high. The number hasn't turned red. Your number isn't red, right? But it's present. And basically the only time I don't treat for H. pylori if it's the results on the GI map, it'll be like a little less than sign, which looks like a caret pointing left. And then it'll say the letter DL, and that means below detectable levels. That's ideally what you want to have to determine on the way that I prefer to do it, the way that I've found is most helpful, is to only not treat H. pylori if it's that below detectable level or below DL. So the reason why, other than the fact of, number one, if you're symptomatic, H. pylori is probably not helping you. And this comes from the reason why a lot of doctors might not even test for H. pylori or might not treat it is because we as in researchers have done taken these large studies, and they'll just grab a bunch of people from the street, whether they're symptomatic or not, and just test, do these people have H. pylori? And what they found is that there are people who would have H. pylori who had no symptoms. They didn't have acid reflux, they didn't have ulcers, they didn't have gut health problems at all, bloating, nothing. And they had acid reflux, they had H. pylori. So researchers figured that, well, we know that H. pylori can become pathogenic. It is a problem. Like, there's certain points in time where we want to treat it. It has like a high ratio. For example, if you have an ulcer, the likelihood that you have a pathogenic level of H. pylori is like super high. It's like 90% of people with ulcers, stomach ulcers, have H. pylori in their samples. So they knew that it was a problem sometimes, but what they decided is that, well, the only way that you can have people without symptoms with H. pylori is if there's a certain low level where it's not a problem. And that's a very reasonable conclusion to come to, but what it's not taking into consideration is that when we don't know what is a pathogenic level for all people. They're assuming that all people have a pathogenic level of H. pylori after a certain amount. It has to be X amount high, and that's going to be true for everyone. But we're all different, right? We have different immune systems. We have different pathogen loads, which I do get into in episode 233, that our H. pylori master episode. We all have different things going on. And so even though you might, and I've had plenty of clients who are under that quote unquote high threshold, it is still a problem. When they go through an H. pylori protocol in our program, they still get detox and die-off symptoms. They still feel better after completing it. And the other thing is that if H. pylori is present, I've had a lot of problems when we go to do another really important step in healing, which is increasing your stomach acid, because low stomach acid is such a chronic problem with people with chronic health issues. When we go to increase stomach acid, if the H. pylori is still in there, they will feel worse increasing their stomach acid because they're feeding the H. pylori, and then it can go from normal levels to high levels because now you're giving it more juice, so to say, to keep thriving. So I have found, hands down, I want to do an H. pylori protocol. We have a month-long protocol that we do in our program, and which is relatively short compared to many other types of protocols that you could do. Most of our other protocols are 2 months or longer, depending what the pathogen is. It's specific to each pathogen. But I talk in episode 233 more about like very specific details on what type of H. pylori protocols are kind of destined to fail, that I all the time will get clients coming into my office saying, this is what I'm doing, I'm not seeing any improvement or changes, or it's still on the lab, etc. So I talk about that in that episode, so I don't want to cover it here. The only other thing that I did want to cover is this for you, Tracy. So do listen up. When you're dealing, I'm guessing you did the GI map because you're dealing with some chronic health issues, meaning just like symptoms that you're having a hard time go away. It's not mild, like, not a big deal, sort of annoying. It's like pretty severe. And unfortunately, just from 7 years of experience now with clients, I never see H. pylori come on its own. And I think some of the reason for this is that I do think that it's true that people can have H. pylori and it's asymptomatic, meaning it doesn't cause that person any problems. But by the time it is causing you problems, there's other pathogens on the scene because it's part of the systemic issue that's going on in your body. Our bodies are incredibly resilient. We have very strong immune systems that should be able to keep pathogens down or get rid of them completely. And if your body isn't able to keep H. pylori down or get rid of it completely, and basically just be symptom-free in general, then we want to be looking at multiple things. So Tracy, I mentioned this, I really highly recommend looking for other pathogens. And I know that the GI map does test for other ones like parasites, it's great for that. It does a marker for candida. It's not the best candida test, and candida itself is not a root cause. So, I'd be curious, like you didn't mention candida was on your GI map, so I don't know if it was there or not. But even if it's not on there, GI map's not a great test for it. And I'll link our episode to candida, our candida master episode, so that you can go and listen more on that one. But you want to look for other pathogens as well, thinking mold, C. diff, bacterial overgrowth, which another test, organic acids test, can look into. And lastly, kind of depending on what you're going to do and how you want to approach killing H. pylori in your body, I really recommend doing other testing like the HTMA, hair tissue mineral analysis, and like a food sensitivity test. I like to use the Zoomer tests. We do a Zoomer bundle to get you like the most amount of Zoomer tests at a super massive discounted price in our program, the Better Belly Blueprint. And when you do this, you actually maximize your body's immune system, which is usually suppressed anyways when you are having symptoms. When you've been sick long enough that you are kind of looking outside the box and trying something like a GI map, which is not a test that's done in conventional medicine. So even though I don't know your health history and all your symptoms, Tracy, this is just something I'm kind of assuming, being that few people are we're asking advice on a podcast when they first get sick. So you've probably not been feeling well for a chunk of time. So I really would encourage you, don't just treat H. pylori thinking that's the only thing that is causing your problems. It is kind of the tip of the iceberg, and it should be dealt with. It is necessary to addressing the whole picture of your health. But I think it would be a little myopic to say that, oh man, I found the one problem, it's H. pylori. When I get rid of it, all my symptoms are going to go away. I would hope that you would have symptom improvement. But as a health practitioner, if you were my client, I would tell you, I would not expect, in terms of setting expectations, I wouldn't expect a client to have complete and permanent symptom improvement after just doing an H. pylori protocol if they came to me with a long history of health issues that they'd kind of been struggling to get a handle on. So I hope that helps. I would definitely get additional testing to get a bigger, fuller picture of what else is going on in your body to get your ideal result, which is that complete and permanent symptom improvement. And then do listen to that episode on H. pylori to get a better idea on kind of how to look for treatments that are maybe going to work, maybe not going to work. And then maybe listen to the Candida episode. We have a C. diff episode. We have a mold episode. They're all next to each other, next to that master episode for H. pylori, because there's 7 pathogens we test for in our program, and I talk about all 7 in there. So that is it. Tracy, thanks so much for submitting your question. It was lovely getting to chat with you and others to get to listen in on this chat. I hope this helps you, give you insight into some next steps and helps kind of guarantee that positive outcome that you're looking for. If you are looking for any guidance or help getting all those other lab testing, whether that's Tracy or somebody listening to this podcast episode right now, if you are looking for help getting additional testing, finding out what testing is relevant to you based on your health history, your symptoms, and then analyzing that testing and creating a customized health plan and protocols based on those labs that is unique to you and designed to get you results by helping you address everything in your body, not just like one very, very specific thing, and kind of ignoring the rest, then I want to encourage you, come join the Better Belly Blueprint. You can go to betterbellytherapies.com/blueprint and read all about it there. Or you can go to betterbellytherapies.com/training, and it's going to take you to a training video. If you're kind of an oral listener or you like to learn via video, then it's a video breakdown of exactly how the Better Belly Blueprint works and why it works when other things have not. And honestly, how it's different than other programs out there. So that is my invitation officially. But whether or not you work with us, you, Tracy, or anyone listening to this, I hope that this helps you guys on your path to healing, because you can heal. You are not stuck. And I cannot wait for you to find your breakthrough. That's it. See you guys next week.